To this week's podcast. So I am really pleased and honoured to be in Tregaron with Joyce. And Joyce is a physio based in Tregaron, and I've come to see her to ask her some of her expertise, just to delve into some questions relations into muscle imbalances, sarcopenia, and we're just going to delve right in. So nice to see you. Thank you for having me. I know that time is precious for you, for our listeners. So I just wanted to say thank you for having me.
Thank you.
I'm going to dive straight into the first question. So first question I have for you is, many people come to see you when they have pain or restriction. What would be your advice to reduce the risk of injury and increase range of movement?
Wow, that's a good question, Beth. So in a nutshell, I guess I'd answer that by saying eat well, sleep well, and exercise, because that's what it boils down to, really, isn't it? But it's probably a bit more complicated than that, isn't it? Mm-hmm. So as a physio, I'm presented with a load of different cases, people with different ages, different lifestyles, different athleticism, different BMI, all sorts of different people.
So from sedentary all the way up to athletes.
Absolutely, yeah. So you've got a big array of people, I guess. And they can all present with different conditions as well, can't they?
Yeah.
So different problems and different conditions. So in the initial assessment, I guess I want to gather all the information. I take quite a lot of time initially just to get to know that patient and what they're presenting with, their past medical history, how they are, what do they do in sport, what's their lifestyle like, are they active, are they not, that kind of thing. And then, so injury prevention, I guess, would be quite different depending on that patient. So you have maybe somebody like a young footballer who might want to maintain good fitness throughout the season, preventing injury.
I usually know my son is a footballer, my husband is a footballer, and I just always nag hamstrings.
Yeah, always a good one.
Hamstrings. It's so tight. Hamstrings are like little knots.
Definitely, and then that might be quite different to somebody who had arthritis or a long-term condition. So I guess I'd want to know what their goals and aspirations are. But I guess consistently exercise is going to be really beneficial across the board, isn't it? So across everybody, of all ages, all abilities, all conditions, then making sure that you're keeping fit, keeping active and keeping well. So I would suggest roughly participating twice a week, trying to do some strength and conditioning work, trying to do some cardiovascular alongside that somewhere as well. And it can be really hard, can't it? With the pressures of work.
I think it's time most people struggle with the people that I deal with. It's just time. And making making they prioritise their children, I talked about my son, they prioritise taking their children to school, or they'll prioritise other aspects of their life and work, but they don't prioritise their health or that they put up with pain or restriction and don't do anything necessarily about it until it gets to the point where they feel like they're bombarded and they can't take anymore. Then they might come to see me to seek action, or maybe perhaps come to see you.
Yeah, definitely. And then it's trying to keep that person motivated then as well, and trying to get them to identify how important over long term. So the long term health benefits of consistently exercising have been proven, haven't they?
Yeah.
But it's hard sometimes. It's hard to motivate yourself, and that's where exercising with friends maybe, or going to group exercises, or having a personal trainer or something, just to kind of get you to engage or keep that motivation.
I was just thinking a lot of people struggle with the fact that when maybe you exercise for a week and you may see no change, there's no physical difference, and it might be that it's slowly filling my tea, isn't it? So you drip by drip, and then eventually you'll fill the cup. And then you'll see noticeable change. But I think a lot of people struggle in the short term. The fact that there's no physical, there's no, if I don't get up on the alarm, there's no repercussions to that.
And exactly.
Long-term pain, obviously, there may be some repercussions to the fact that they didn't get up for the alarm for the last 10 years to do exercise, or that they didn't bring in other factors, maybe. Maybe you're somebody that's an athlete and they haven't made time to bring in some flexibility work. I think for me, I've always found that people tend to do what they're good at. And I really was a big game changer for me in my training was when I really started to focus on the things that I wasn't good at. And I think it was one of them was I had some lower back pain maybe about 15 years ago. After having my eldest, and I did like a standing, I went to see physio and they gave me like a standing check where I had to stand on one leg. It became pretty obvious that I had some muscular imbalances and that I needed to work a lot more on hip extension movements, hip like bridges, slight abduction movements, and I just started to do the exercises and started to notice a difference and just how, I think it can affect everybody. It certainly can affect. I know for me that going to see a physio really was a turning point for me, but I had to really work on to do some of the exercises that I wasn't as good at. So at that time I was running, and I was really good at running, but like I remember sort of sitting down and having tight listen to my bum cheek and having some and all these kind of signs that were there showing me. But I just chose to I needed to get my 5K time. I just need to keep not actually focus on. Actually, I need to do some more flexibility work. I need to do some more strength and conditioning work. So I definitely think from my personal experience, and maybe I don't know whether you find with work that maybe sometimes that's the case too. Whether it's some people that are just sedentary or some people that are just struggle to do the things that they find difficult.
And it's recognising that, isn't it? And some people are used to exercising and have always exercised and enjoy exercise. And you might have people who it's quite new to them, the concept of exercising, or they haven't, they lead quite sedentary jobs where they're sitting in offices quite a lot. And it's trying to prevent that, isn't it? And trying to recognise the benefit that exercise would have on you. And you might have got somebody who is sitting at an office that they just need to move and they just need to get exercise.
And I definitely found since I went online, before I'd have an hour with a client, or I'd have just maybe a short period of information, but having worked with a lot of my members over the last 4 years, that some of us are under massive stress, and the amount of hours that we work, the pressure on that we, from, as I said, families, but the amount of hours and the amount of how many of my clients are sedentary, and they really find that by doing the exercises, by getting put on the alarm or getting the sessions done, it's made a massive difference in their posture, in pain, in
well-being,
because it's so. I know for me, I sometimes just thought I've got to get out of the room because if I'm on the phone, if I'm on the computer for too long, I've just got complete overload. I need to just get out for a little bit and just see some wildlife or just get out because it's so much. But even me, and I'm aware of my posture, I find I'll be in this position and then I get naturally I'm no, you can't.
It's hard to maintain, isn't it? Because things like that regarding posture in particular, it's quite okay that we all do slump a little bit. It's the amount of time that you're doing that for. So if you're sat at a computer for 3-4 hours and you are just adopting these positions, well, that's not really healthy, is it? But it's it's impossible to maintain this sort of posture.
The minute I say everybody that's watching this will be how you doing?
Yeah, definitely.
Okay, so I've got another question for you, which is, I know for me, I'm a firm believer in a positive mindset, and I think this can really have a positive effect on recovering from setbacks and from injuries. What advice would you give to anyone dealing with pain, or particularly with chronic pain?
Yeah, well, pain is a very complex topic, really.
Yes, I know it is. That's a massive question.
And
I know that could vary from person to person. But generally speaking, what kind of rough, if you were to say three things, what would you recommend?
So I guess with pain, I'd be thinking acute pain or chronic pain, like you just mentioned. So acute pain, it's a little bit more. So you might have got somebody with an ankle inversion injury or a muscle sprain, and you go with your time frames and your tissue healing in order to kind of help them improve. So a little goal setting for that would be really important. But chronic pain is another kettle of fish as well, because you've got people who've suffered from pain for a long, long time potentially. Might be sort of 3 months, 4 months, 5 months, but it might be 20, 30 years, and they might be, really struggling. So it's trying to identify, I guess, what's driving that pain, I would say, because different factors can can cause them
Yeah.
to have. It might be that their pain is related to trauma or chronic
Yeah.
conditions,
Yeah.
and it's how disabling that or how much that influences them. And I think stress is a big factor.
Absolutely.
So managing stress is really important with pain of all levels, because there's a high correlation there between with stress and pain levels. So it's, the ways that people manage their stress can be quite personal, quite individualised, but things like breath work can be really important, like breathing, and I guess meditation can be useful. There's some really good apps out there, like Headspace app.
I have to say that people that are struggling, certainly a lot of my clients that may be perimenopausal or menopausal and they're struggling to kind of like settle and get into like a night routine, get to sleep, like just to have that time to just, and we spend a lot of our time in the sympathetic kind of mindset and not actually spend enough time in that parasympathetic, just kind of slowing everything down, slowing our breathing down, slowing our heart rate down.
And I think that really helps with pain and helps manage pain as well.
Definitely.
So
that's a cue to do Pilates.
Pilates and yoga are brilliant.
I do. One of the things, and it's always for me, I'm like, you need to do Pilates, and I think for me, I just find my members and like other people or like in personal training across the board will love the endorphins, but struggle more to get the more of the work doing things that they don't particularly maybe have that big rush of endorphins from. But I was like, just trying to do Pilates and make a big difference.
Definitely.
So, it's not just
and you mentioned like a positive mindset, and I think that's really important. And it can be difficult, can't it, with the stresses of life and work-life balance, and you've got young family and things like that. And it is okay. I think it's recognising it's okay to not always be positive as well.
Absolutely.
It's hard to be.
There's a lot of pressure, isn't it, all the time to be.
Yeah, definitely. So it's finding the key things that help pick you up. So what makes you feel better and what helps you as an individual. So I think for me, it's like going out and exercising really does help. And I think exercise, like you mentioned, like the release of endorphins and your dopamine levels and stuff, really has positive effects on pain. And whether that be, some people might not manage going for a sprint or like 30 minutes on the treadmill, but just a walk with friends, and it can really help you.
Absolutely. I always just think if I help somebody and they said, my lower back's not feeling great today, which I think any time like a lot of people over sort of 30 tend to find that the lower backs tend to get more grumpy. And I'm like, this is like the natural curvature of our spine. Like it's a normal thing as we get older that a lot of people will, and as we talked about, day-to-day movements. And I was like, just try not to stay completely sedentary if you can, even if that's just small movements around. And so many times, I mean, you have way more knowledge than I do, but I just feel that when that information is relayed, it always comes back to me, actually my back feels a lot better for just some gentle movement.
Definitely. It really helps. And sometimes it's taken that focus away from the pain, isn't it? And thinking more functionally. So it's like with people, especially with chronic pain, who've had that pain for a long time, you might not get rid of the pain, but you might be looking at function and exercise and what can you influence. So it might be that their goal might be to walk the length of the prom. So you're just trying to encourage people to do what they can and listen to your body, because listening to your body
is so powerful.
Your body's very good at telling you if you've done too much or haven't done enough.
I say this, usually like if you have pain, it is your body's way of telling you that you need something that's out of situ. There's something that we need to work on, and like that, try not to ignore those signals.
And I think understanding the pain, I think like a big part that I do is educating people. So if they're presenting with something, that's really painful, it's quite scary. Pain gives you warning signs, doesn't it? And if you don't understand the reason you've got that pain, your brain is very good at catastrophizing things.
You're like, I've got this wrong, this wrong, this wrong.
Look on Google. Absolutely. So if you can kind of try and calm that bit down and get somebody to understand exactly what's going on and why.
I thrive off that. I think if I look and I'm like, well, this is the reason for this, and it helps me to just to cope with the situation and have a plan. So I think it's important to, even if you have pain or if you have some weakness or whatever it might be, or if it's something you want to work on, even in relation to like relationships or work, but if you've got a plan, then it's something that I can naturally action,
Yeah.
and then that makes me feel more positive. And just feeling like this is the situation I'm in, and this is like I don't understand it, and I don't know what to do.
Yeah, I do think it's really important with people to like set those goals, or at an individual level, really, so that you can work clearly towards achieving something, and they can see their progress then. And it doesn't have to be massive, does it?
No, just even if it's something small, and you're just like, I've made a difference. And that's enough.
Absolutely.
So one more question for you. Lifting weights. So obviously I'm passionate about lifting weights. I'm very passionate about resistance training. I'm very passionate about resistance training as we age. So talked about
same here. So as it's turning 40, you get a little bit more
I think my dad always is like, my dad was always into sports. My mum not so much. My dad used to play golf. And like he had dementia, so I cared for dad from like 2012 to 2021. But like dementia is just savage. So I think seeing somebody that had gone sort of from very, and I think for me, like having dad for probably as long as I did was testament to the fact that he exercised for as long as he did. And like there's only so much that we can do with our genetics and the other lifestyle factors that the life that he led. But I think exercising for me was massively impactful. But I think I think it's just seeing somebody naturally. How dementia just savages the body. And I really want to just stay as strong as I can and as healthy as I can for as long as I can. And also I'm very I'm very independent. I like to do it, so I want to be able to do as much as I can for as long as I can without having to ask anybody to do it for me. So I wanted to ask you about lifting weights helps to offset sarcopenia and improve bone density that we know. As a physio, why would you say that this is important? So what would what would your take be on it?
Yeah, well, I'm also quite passionate about this because there's quite a lot of evidence now saying about the importance of weightlifting and strengthening, and it's quite an eye-opener that muscle mass decreases by about 3 to 8% per decade after the age of 30. Like, it's quite young, isn't it? And then that gets even faster after the age of 60. So I think it really helps with prevention of injury. We talked a little bit about that, didn't we? But things like hypertension, that has really, big consequences for cardiovascular health. So it's been proven to help with hypertension, body composition and feeling good, well-being. But not only that, things like your metabolism, your reducing risks of diabetes. And also thinking more of the elderly, like you've also got you see people getting more frail, don't you, as they get older, and there's a risk of falls and osteoporosis and much greater as we get older.
That's how dad he got up and just fell. I think we were in the living room, dad was in the other room, and then that was kind of and I knew it was the beginning of the end, because he broke his hip, and then it kind of and then that has an impact then on dementia. Like you kind of each time his dementia would drop.
Exactly like you were saying, like try and control the things you can control. So if there's things that you can influence, like lifting weights, keeping your muscle mass, and that has positive effects on your health, well, you really want to try your best to influence those things, because there are going to be things in life that we can't change and we can't influence, and we do need to accept, don't we? But if there's things that we can have a positive effect towards, and it doesn't have to be that complicated, does it? We can keep it quite simple. But lifting, you do some upper limb, lower limb, some core work. You don't have to spend ages doing it. 20 minutes, a few times, 2 or 3 times a week, just has a massive.
Even I remember when I was working, I told you I used to work at cardiac rehab. And seeing some of the patients then started to not lift heavy weights, but just lift some light weights, and just like the empowerment that gave them, because then running like I do, one of the classes that I would do is like a Tabata class or a high impact class. That's not for everybody, but resistance training I think can be something that you can do like throughout your life. You don't need to lift super heavy.
It makes you feel good too.
Definitely. So I also wanted to ask you, leading on from that, what made you want to be a physio? So what kind of inspired you to
question? It's quite a hard decision when you're younger.
I have this with myself. He's just going to be like he's just started as a trainee electrician, and like you are just the whole like he went back to school for a year and then decided actually he didn't want to continue on, and has like I was like, well, he was like, I want to be an electrician, and then like we try like, oh, was he going to do it? Is it like, and then he's managed to get placement and he's doing it, and it's like the best thing ever for him. So like. But it's such a massive decision to make, like to what career
when you're young as well, and it's making So it was my granny that influenced me a little bit actually, because I used to go around to my granny. I used to encourage her to exercise and get her out, and like she still have a good foot massage and stuff. And she said, "Oh, you should be a physio." I had no idea what a physio was at that stage. And her best friend was a physio. And so she kind of planted the seed, and then from there, it's just, I really, I've always grown up enjoying exercise, I guess. I enjoyed sport at school, and, weekends we used to go out walking with mum and dad, so always been quite active. And then seeing
Did you grow up in
And then
so you've just been blessed with like all the surrounding area. I always find that a lot of people that are local to Tregarra are like, I don't know, like even I live in Bronham, and like it's normal to be like, to see somebody out with a head torch at 6 a.m. Like I just think it's where we are. It's great.
Definitely. I think just like I like helping people. I find my job really rewarding, just because you can help people on a daily basis, and just getting to know people really well, getting to know the history, and I think just when you see people who have injuries, and you can just influence people and make changes, and there's nothing.
I make massive changes to some people. Like it just
really rewarding, isn't it? And
I think I always think for me, even if somebody they might just have been exercising and they've been with me for like 3 months or 3 weeks, 3 weeks, and they'd say, I've noticed this, and it's just like it might only be one. You're just like that's just amazing. Not for me, but for you, and the satisfaction. Like for me, it's not always like the number on the scale or like the big transformation, but it's just like how I feel and like the difference that exercise can make, or the difference going to see a physio can make. Okay, so I also have a couple more questions for you. Okay, so in your professional opinion, what are the musts we should be including? So what would you say that everybody should be doing? So
good question. So I think touched on that just now, but change the things that you can change. And maybe accept the things that we can't. So if you thinking about diet, your sleep, your exercise, well those are things that we can do things about that can have really positive health benefits, can't they? And there's some things that we can't change, injuries and conditions that we come across. Then it's accepting that and also managing that, and how you approach that and accept and deal with it.
I definitely think people sometimes hold shame when it comes to injury. Like people feel that it's that having an injury is something that they maybe don't want to disclose, or and I think injury is something that happens to like athletes, to somebody that's completely sedentary. It happens to people across the board that you can't. It can just be something that's a freak accident. It could be something that, like I talked about, like it's a slow muscular imbalance that builds up over time. I've got 4 children, the effects of carrying children, like all those kind of things. But so it's nice. It's nice to hear it from you too. Just that I think it is important to do what you can do.
And then consistency, I guess, is another point, like consistently doing something, because I think what we're guilty of doing sometimes is you'll start doing something for 2 or 3 weeks and then you expect changes quite quickly, but we want to be thinking more long term, isn't it? If you consistently exercise long term, you're looking at least 8 weeks, 9 weeks, 10 weeks, aren't you, for muscle?
I think a lot of people, for me, they'll join and they'll say, I just joined you for 6 weeks, and they kind of just thought that's all that they were going to join for, and then maybe I've got members that have been with me for 4 years, and I only joined thinking that was going to, but it becomes a lifestyle. They feel the benefits and they want more of it, and they realise, even like for myself, I'm still chasing things, so I'm still, it might be like I want to do another pull-up, or there's always things to work on, and it never stops. And that should be like something like in relationships or work, there's always should be things that you want to be like, this is where I can progress, or this is what I can continue to get from that. And I think sometimes when it comes to our physical health or exercise that we expect instant responses.
We're quite impatient.
Yeah, and I think sometimes it's because we maybe have long-term pain, or we've got an injury that's occurred, and that we don't go and address that. So I use an analogy with my clients, and they'll have heard me, I just say, it's like flossing your teeth all the time rather than and cleaning your teeth and having good dental hygiene, rather than getting to the point where you get really bad toothache and you're like, just take the tooth out. It's kind of think of exercise and what you can do, whether it's yoga, whether it's Pilates, whether it's running, whether it's strength training, but to do that consistently and
enjoy it
that
as well.
What you
enjoying it, isn't it? And finding the right exercise that you like doing. And whether that be with friends, or like I say, if you struggle with motivation, then you might need to go to groups or see a personal trainer. And I guess the other thing is, if you are struggling with something, do try and seek help, because people do try and muddle on, don't they? And they try
self-diagnose.
You might have had a pain for a very long time, which is a bit harder to manage then. So if you're struggling with any symptoms or injuries that are reoccurring all the time, then you might need to seek a professional opinion about it.
Okay. And then my final question for you is, if somebody wanted to come and see you, how would they go about that?
Oh, well, probably the best way is just send me a message, like give me a phone call. If I don't answer, just leave a message and I'll get back to you.
Okay, so Joyce is super busy, and I know that I always think it's so important, because I think, as I said, I find that a lot of people might say to me, Beth, I've got like this pain here, and I'm like, actually, that pain could actually resonate, here. It doesn't always, like, we're so, sometimes we're like, I've got knee pain, and it could be the fact that it comes from ankle restriction, and that you need to work on, because something completely that you're not, it's not always, it's not always what's obvious, so that sometimes it is important to go and seek that help. It is important that those small little actions and the small changes or the benefit, the exercises that you may give can have a massive benefit. It's just trying to,
I think patients are often quite like alarmed, really, because you'll be assessing one thing and then and then oh wow, you can see that moment when they're like, oh, that's really interesting, it's really fascinating.
Definitely.
It's good.
Good. So, is there any questions that you want to ask me before we finish?
Oh, well,
don't put under pressure, you don't have to ask me anything. Because I wanted to come and see you predominantly, and I think you're having your knowledge, your experience, and your time. It's like massive for some of the people that follow me. And I think just being able to, again, some of the things that I might have spoken about, and it's been lush to hear you talk about it, and so just any questions that you...
I was just wondering, actually, do you do most of your sessions at home in Brunel? Do you do groups? Or
so what I do is, I used to be gym floor PT, so that's all I did, and then I did group exercise with large groups. And then what happened was that I went online, and I so exactly as I'm doing here now, I live stream every morning at 6:45, and I deliver. Most of my members, they kind of get up on the alarm, they do the session, and then they go to work. But then it's also, just as we're doing now, it's then uploaded up onto YouTube, and then they can watch it in the evenings. But I also do, like, I've got my garage that I've got at the minute. I've got Adam come in to do my new electrics, and I've got another guy coming in a couple of weeks to put a new patio doors, and I'm having all it we're turning it into a hub. So it's a garage, but it's just been completely blinged up into my own gym, where I'm able to have clients and have personal training, because some people get quite nervous going into a gym, and some people get and especially if they've never been into a gym before, or just to have that one-on-one time, and being able for me to break exercises down and gain confidence in lifting weights, because I think for most women, we don't want to go into a gym and look like an idiot, and we don't want to so sometimes it's easier to just get onto a treadmill and think oh, I can turn that on. And they get nervous, or it's a cross trainer, or they focus on calories, and having somebody to give you to free you away from the scale and think more about your actions, and then how moving more, lifting weights can change your metabolism, can increase your weight. All of these things can make massive impacts onto their body composition. we join in and we do like a live session in Aberystwyth, and then we go for coffee afterwards. So it's a bit like it's a bit of a social, but we're also this weekend we're walking up Snowdon. So there's like lots of like things and events that we do, so we can kind of stay together. But then you can get up and do it in your living room without, some people must do it in their pajamas, some people just must slide it and not feel like I've got to get
choice, isn't it?
Yeah, and I think certainly for me living in Brougham, going to the gym is not time efficient. So if I have to, unless I'm got to be in town, for me to drive all the way to town to spend 45 minutes in the gym might take me 2 hours. So it's not, when I've got family,
children.
It's for some people it's great. If you work on the university, if you're right in the hospital, you might be able to just nip up, but it's not for everybody. So it's just being able to remove the barrier, to like allow like other people to exercise that maybe would never have exercised and have said that they can exercise consistently now because they have that whole thing of like being supported. And if you've got up and you're like, you've got to do this, and this, and like sometimes it's like, oh, what am I going to do today? Right? And you might be like, do you know what I mean? You go in, you might mess around for a little bit, and you might pick up a little bit. I'm like, right, no, do this, and this, and so it's like it's effective, it's done, it's dusted, and then they feel good as a result.
Okay.
So that's fun. Thank you so much for listening to our podcast. If you've got any questions, I'm going to, you can put them below and I will come back to you as soon as I can. I'm also going to put a link so that you can contact Joyce if you would like to and ask her any further questions. Thank you. Much love.
Adios.
Bye.